Okay, number 10, end the privatisation loophole. So too often, NHS money flows to private providers. So we need to end the outsourcing culture, where that outsourcing culture is, frankly, a boondoggle, I think the term is in the States, where it is essentially an easy ride for those corporations that frankly make significant profits and don't really add the value that they promise. Now, don't get me wrong. Again, I've said it probably for the fourth time. I'm sorry. We have to recognize that a lot of suppliers, a lot of outsourced supply is incredible. That could be in construction, it might be in catering, it might be in transport, but frankly, there's an awful lot of problems in these areas as well. Let me give you one example. My mum, when she was transferred to the Hayward Community Hospital, in fact, it's two examples in one. It's a 2-for-1. So when she was transferred to the Hayward, she was, with her stroke, very debilitated. She couldn't speak. She needed scans on occasions. And I went to visit her one day and arrived at, I think, about 2:20. And it turned out about 10 minutes earlier, she'd been sent to a scan at the Royal Stoke Hospital, about 4 miles away. They didn't have the advanced scanning machinery at the smaller community hospital. So, first of all, you get there and the patient, my mother had gone. So I thought maybe a couple of hours, I'll wait around. So I waited and I waited and I waited. And when they send her, they have to have an ambulance. They also have to have someone to accompany her in that case. And so one of the healthcare assistants accompanied her on that trip. And I waited and I waited. And in the visiting time, which is another issue, we will come to visiting times, open visiting times, that all the studies show they are better for patients, better for the families, and even better for the hospitals. But for some unbeknownst reason, many have very fixed visiting times, and they're really not in anyone's interest, from as far as I'm concerned. I'm going to look out the study and see if I can find it, but and I'll put it on screen if I can. But the reality is, my mum went for that scan at 2:00, and it was at least 8:30 in the afternoon. No, it was 9:00. She came back 9:00. So 7 hours to go for a scan. Now, frankly, there should have been a way of notifying myself and my nephew that where she was. But okay, we can let that slide. But the reality is, this stressed her out incredibly. There was no food at the Royal Stoke Hospital, and she gets back. And apparently they've been waiting for transport all this time. But she gets back, and the company, the outsourced catering provider, I think it was Serco, they were unable to provide a hot meal. They could not. Now, my mum was on what's called level, I think at that time, level 4, which is essentially pureed food. And I just cannot get my head round the fact that a catering company was not able to provide a hot meal. So I had to, obviously I was there for her to come back, and she was clearly stressed by the whole environment. So I had to, and because she couldn't speak and communicate in any way, I had to advocate on her behalf. And the most they could do is to heat up a tin of soup. So I was absolutely livid. I was furious. And I was a little bit rude to the caterer, which I did apologise for after, because it wasn't their fault. But between the NHS trust, between the catering company, the outsourced catering company, this is crazy. And so many people in that hospital had said, yeah, when they had kitchens and staff and cooked their own food, they had flexibility, they had much higher ratings, and everyone was an awful lot happier. I don't know. What do you think about this? Okay, so yeah, money flows to these providers, and we need to end, I won't say all outsourcing, but we need to end outrageous outsourcing where, frankly, these major corporations are not adding value to the system. They're sucking value out, and they're sucking profits. Some would argue, many of them would argue, that actually they're cheaper overall. But when you take overall satisfaction, when you take, the cost of changing a light bulb can be, extortionate and doing simple things, because there's no staff there, unless that staff needs to come to change the light bulb. The old-fashioned way was to have engineering teams and maintenance teams, and they are part of it. And I think the challenge is people are disassociated. They feel like they're not part of this mission. They work for that third-party supplier. So how do we untangle this spaghetti? How do we get rid of these organizations? Well, there's got to be a way. There is a way, and we've got to be radical. We've got to hold these organizations to account, and if they are not delivering what they should, they've got to go. Okay, so there's ideological commitments to privatization. There's resistance from some of these stakeholders, but we need the strong leadership that puts patients before profits.